The biggest trade deal since Brexit? That's what the UK Prime Minister says he signed with his Indian counterpart Narendra Modi today. But already there's a bit of a political backlash in the UK. What's in the deal and what does it mean for Britain and the world? We'll discuss on this episode of the BBC's daily news podcast, Newscast. I was going to say welcome back, but actually it has only just been a bank holiday. It just seemed like quite a long one.
It did, didn't it? Really, in its own kind of way. Yeah. I was reflecting with somebody earlier on that a week ago I was in Lincolnshire, charging around a pretty big county, covering the mayoral race there, and it seems like longer ago than a week somehow.
Oh, actually, I just realised we last spoke on Friday morning when we did that live episode of Newscast when the Runcorn by-election was clear, and a few mayoralties were clear, but nothing else was.
This is the thing.
Would you like to update me on your thinking now?
Yeah, well, I think broadly speaking, where we were on Friday morning is sort of where we ended up, albeit with some subtlety. So we were talking a lot, weren't we, last week about how you had to see the local elections and the by-election in sort of two parts. There was the overnight stuff with its emphasis particularly on reform, and then later in the day, a story that would be perhaps more focused on the Liberal Democrats making gains and the Conservatives making a lot of losses. And that is how it bore out. But the most striking sort of news elements, if you like, of the whole thing were reform's gains. There's just no doubt about that. Even when you price in and factor in Labour having a tough night, Conservatives having a really difficult night, Lib Dems doing pretty well, Greens doing okay.
And the big political story that's broken on Tuesday afternoon is the signing. Well, it's not the signing because the signing hasn't happened yet, but the end of negotiations for a free trade deal between the UK and India. And those negotiations have been going on and on and on and on, and then off again, then on again for about 3 years. And we'll talk about that in a minute. But the thing that really struck me as a political story on Tuesday morning was the Welsh First Minister, Eluned Morgan, doing a really spiky speech where she was incredibly critical of her boss, Keir Starmer, and just all the politics that has led her to do that.
The cuts in winter fuel allowance is something that comes up time and again, and I hope the UK government will rethink this policy.
A previous guest on Newscast, of course, the First Minister of Wales, which you can find on BBC Sounds. So she was giving a speech in which, and this is familiar territory for the nerdiest of the newscaster contingent, because rewind a generation and you had a Welsh First Minister from Labour talking about the clear red water between the Welsh Labour government and the Westminster Labour government. And effectively, that's what we had from the current First Minister, who was publicly talking about and trying to walk the tightrope between what she sees as the value of the same party being in government at either ends of the M4, but also being willing to criticise the government at Westminster, particularly on some of the benefits changes, not least the personal independence payment, and then also the winter fuel payment and millions of pensioners no longer getting that. And already, because this is, as you know, is how politics always works, that you get through one cycle of elections and immediately the focus turns to the next one. And in a year's time, exactly a year's time, there will be elections to the Welsh Parliament, to the Senedd, and also to Holyrood, to the Scottish Parliament. And they are going to be big for Scotland and Wales, respectively, but big for UK politics as well. Not least because, yes, reform, but then also the SNP, can they go into a third consecutive decade of power in Scotland? What about Plaid Cymru, who are pretty buoyant in Wales at the moment? What about reform in Wales and to an extent in Scotland too? Could a century plus of unbroken power for Labour in Wales, in one way or another, either devolved government or dominating amongst MPs on the whole, could that be broken?
And I just thought it was interesting that when she was speaking to Sarah Montague on The World at One, Eluned Morgan was really explicit about what her political strategy was here. She acknowledged that she perceived a threat from reform, so she didn't sort of like take up the idea that reform were like maybe challenging her. She actually bought into the word threat, which was quite explicit. And then she went even further and said, but I'm also worried about a splintering on the left, so I am moving to the left. And like normally people sort of do stuff and hope that people get the message. She actually just explicitly said the message.
Yeah, and I think that speaks to the kind of political reality that Labour in Wales feel and face at the moment, which is they feel under threat. It feels competitive. You know, Welsh politics hasn't necessarily always felt all that competitive numerically with Labour's sort of strength for so long, but with reform, with Plaid, with a change in the election system and indeed the number of seats in Cardiff Bay. Put all of those things together, coupled with a Labour government at Westminster. In other words, the Welsh Labour Party are not pushing against a Conservative government at Westminster. They are having to defend what a Labour government at Westminster is doing. That is quite the combination of factors that I think you're now seeing Wales's First Minister respond to.
From Cardiff Bay to the Bay of Bengal, there is a UK-India trade deal. And seeing as we're talking about globetrotting, here is globetrotter extraordinaire Faisal Islam, who has entered the Newscast studio while Chris was talking there. Welcome back from Canada.
Oh, good to be here. Not just Canada, America as well.
And America, yeah, of course. Right, let's hear Keir Starmer trumpeting this deal he has done with the Indian Prime Minister Narendra Modi, which he did on Tuesday afternoon.
This is the biggest trade deal that we, the UK, have done since we left the EU, and it's the most ambitious trade deal that India has ever done. And this will be measured in billions of pounds into our economy and jobs across the whole of the United Kingdom. So it is a really important, significant day.
Faisal, we'll come on to the economics bigly in a second, but Chris, just the politics of this is something that a British Prime Minister has wanted to sign for ages.
Yeah, I mean, I remember going to Delhi with Rishi Sunak for a G20 summit, which was almost 2 years ago, September 2023 from memory. And there was loads of talk, I mean, primarily from us reporters, it must be said, but nonetheless, there was a lot of chat about the India free trade deal. And to be fair to Mr. Sunak, he made the argument that it was better to get it right than to rush it, etc., etc. He'd have loved to be able to do it in his time in office. And here is Keir Starmer able to trumpet it as the single biggest kind of breakthrough as far as a trade deal is concerned since the UK left the European Union, the fifth and sixth largest economies in the world, doing a deal to improve trade, in essence. And what's striking, Adam, I was at a briefing this afternoon that Jonathan Reynolds, the business secretary, was hosting, and within seconds of the briefing starting, he was saying, this is an example of what the Prime Minister calls, to quote him, going further and faster, that line that he was using in response to those election results last week. In other words, that if you like, the muscle of government and its capacity, yes, to make decisions and trade-offs, but to achieve stuff, and so they hope in time, things that people will notice the benefit of. Now, Faisal will be able to get into so much of the really important detail on all of this. One thing it's worth saying at the outset is that this will take time even from here on. So someone said to me, let me find it in my notebook, there's a great phrase, touched on something you were saying a second ago, Adam. This is great podcast experience, isn't it? This flicking through a notebook. I'm going to find this because this is a great
We're just playing in sound effects at this point to make it sound more convincing.
Oh, here we are. Yes, it was described as a conclusion of talks moment.
Yes.
Rather than it being the end of the process. We're talking at least, I think, another year yet. It'll have to get ratified through the Parliament, yada, yada, yada. At some point, there'll be a signing ceremony and no doubt a trip. In fact, the Prime Minister accepted an invitation to go to India when he was on the phone with his Indian opposite number today. But yeah, from the government's perspective, broadly speaking, this is one of those things that you can trumpet as good news.
Yeah, when I was back in Brussels, when, of course, the EU was in charge of British trade policy because we were a member of the EU, I found that trade deals were announced on average 7 times. And also, I remember being a political reporter back in 2022 when Boris Johnson said this trade deal would be done by Diwali.
Yeah,
so
just didn't
October.
say which one.
But yeah, that was October 2022. It's been done by Diwali, October 2025. Right, Faisal. And also, Chris, stay there because there's some big politics blowing up around this already, like incredibly quickly. And I want you to explain all of that to me. But Faisal, explain the kind of the economics behind this deal, beyond just India's a big economy and it's good to be close to a big economy.
I think the broad picture here, what you've got to factor in, is that India is a highly protectionist economy. And you've heard Donald Trump talking about that as well in the context.
In other words, they have
of
lots
the
of
US.
tariffs on imports.
Very high, like not just double figures, but triple figures. So 100% or more. And what this deal does is it takes away the tariffs for British exports into India, eventually for about 85%. And then the other way, 99% of what India exports to the UK, that goes. Now you think, oh, hang on, they've got a much better deal. But when you account for the value of what we export there, high-end cars, whiskey, of course, famously, and medical devices and things, and what India exports to the UK, clothing, textiles, footwear, and the like. Actually, the value of the £25 billion a year increase to trade by 2040, 15 billion of that is to the UK. If you believe the forecast, 10 billion to India. Now that's really interesting. That gives you it's about a £5 billion boost to the economy according to their calculations, which is relatively modest, 0.1%, not earth-shattering in terms of GDP, for example. I would say, though, this deal is importantly different to some of the other deals, which are a lot of which have been basically photocopies of what we had under the EU. This is genuinely new trade access. And I think for this deal more than any other, you can make the argument that the figures they're putting out could underestimate the potential benefit. Why? Because of some of the stats about India. And it was really interesting. I've just been editing our 6 o'clock news piece right now, and I was like, I want pictures of the India that I saw when I was on holiday a year ago, which is the India of skyscrapers, of massive monorails. Yes, there's the sort of rural kind of workers, farmers there too. It's an extraordinary array of different economies in one place. But it's also a modern, thriving metropolis exists besides oxes walking through the streets. Yeah. That's what you've got to get across. And the growth of that middle class is potentially epic, right? In terms of it. So I feel like, whereas some of these trade deals over the past since Brexit have been somewhat kind of shined, lipstick have been put on what is the same sort of thing. There's real potential here, and there's also a chance to make up for lost opportunities between two countries that have had very strong historic connections, obviously, and for whose we didn't really get it going in terms of our economies.
And if we're talking about Indian holiday anecdotes, I remember when I was there earlier this year, walking past one of the very fancy shopping centres in Delhi, and my friend pointing to a Chinese electric car and saying, "Oh, the person that owns that car is really fancy pants because there's 100% tariff on that car. So they've basically paid double just so they can have that car." So that's an example of what India does to protect its domestic car industry from foreign exports, foreign imports.
Absolutely. So highly protectionist, as you say, and they've lowered those very high protections to sort of high, sort of absurdly high protections to just
normally high. Yeah.
Very high. That's what we've got. Now, I should put in a big caveat here, which is the devil is definitely in the detail.
Which we don't have.
We do not have the document. We have managed to, in that briefing, extract various details which were not in the press release already. So you mentioned electric cars. This is quite interesting. So we're going to be exporting a quota of 22,000 high-end cars to India. That's going to help Jaguar Land Rover, which happens to be Indian-owned, by the way. And in return, after some probing of the business secretary, it was revealed that there's going to be a quota of 88,000 mid to low range cars coming from India. Now, that's quite interesting, right? Well, that would be a different type of car that we won't have seen before, potentially competing with China at zero tariff. It really depends how these things are phased in. There is a world of detail here that may turn what at the moment is a good news story for the government. They've managed to get this deal done, which other governments didn't. Some true Brexit believers didn't get this deal done. They got it done, which may provide some stings in the tail. For example, the agricultural market access. Really, how's that going to work out?
Yeah, we haven't heard anything from British farmers yet.
I mean, as I said, I think the big numbers, the big strategy. The context, obviously, internationally, that, this is happening at a time when the world's top two economies are having a brutal trade war where they're instigating tariffs of over 100%. This is the world's fifth and sixth biggest economies. And by the way, it's India that's now the fifth and we're the sixth. Really lowering trade barriers like we've never seen before. So and in a way, those two things are not coincidence, right?
Yeah.
I think that but I'm interested to know the full detail on what we have actually given.
Yeah.
I don't have yet.
Yeah. Chris, though, I talked about the political backlash that has already started. Just explain to us what's going on this afternoon.
Yeah, the Conservatives, Kemi Badenoch, former Business Secretary, of course, Conservative leader, and indeed the Liberal Democrats, chiming in on a particular element of this that was talked up by the Indian government when this was announced, rather less so by the UK government, which, as the Indians put it, is an exemption for Indian workers who are temporarily in the UK, both for them and their employer, in terms of paying national insurance. Now, it's worth saying, and the government is emphasising, that this is conventional, that this happens in these kind of deals. And as we talked about ad infinitum on Brexit Cast and Newscast and all the rest of it, all trade deals involve trade-offs. You know, you've got to give and take in order to get a deal over the line. But the Conservatives are claiming this means that the deal is lopsided, that this was a reason why they didn't sign it. And obviously the politics around national insurance is pretty potent, given all of the arguments there's been over the government's hike in employer national insurance in the last few months. As I say, the government making an argument that this is pretty conventional, but that's where there's a little bit of a spike in the domestic political reaction.
Chris, I think you've got to go, so I'll speak to you soon.
Grand. See you
Bye.
later. Cheers.
Yeah, Faisal, go ahead.
There's a really interesting paradox here, though, isn't there? Because you've got a Labour government, as they put it, like making Brexit work. And when they've done the trade-offs that are necessary to do the trade deals, which were the great prize of Brexit, I'm intrigued to know what Reform would be saying about this. But the Conservatives have said, "Oh no,
Nigel Farage has already posted a video.
Oh, okay. Well, we don't want this sort of trade-off on national insurance. Obviously, the missing thing here was the fact that every time we tried to do a deal like this, including go back a decade under Vince Cable and Theresa May and the coalition, when the EU tried to do the deal, the story is it's the UK's concerns about visas that scuppered the deal for the whole EU. That has repeated, and now in this deal, there doesn't seem to be really substantive change to visas.
Yeah, it doesn't look like there'll be more Indian workers coming to the UK,
albeit
for because of the immigration system,
which has been a consistent ask. Albeit, one might say, over the past 2 years, one of the great increases in net migration has come from India anyway. So maybe they've, in a way, already got that. The single biggest source of migration outside of the EU has been India, about 250,000 long term in terms of...
And that's Indian workers coming through the points-based migration system or as part of a family of somebody who's already here.
Yeah. So maybe that's the win baked in already. I don't know. As I said, I do like some of the detail here matters, but there is some paradox, and it's very interesting to see how much the Conservatives have come out against what is one of the great prizes of where they have led politics for the past 8 or 9 years. I mean, this genuinely, obviously, this wouldn't have happened without Brexit, straightforwardly, and it is the biggest economy in the world. Sorry, it's the most populous economy in the world. It's one of the fastest growing advanced economies in the world. In terms of the potential middle class that's going from poverty or low income to middle income and high middle income and will be demanding of the sort of products the UK makes, immense market out there for the taking, cultural connections. You know, you can really see this flying. And it's the sort of thing, actually, that maybe didn't happen, one might argue, because the UK joined the EEC all those decades back in the first place. So it's absolutely fascinating where this goes. But as I said, like, we have given some stuff here, and at the minute we don't quite have the full detail to assess how tricky that will end up being.
Yeah, for example, that briefing you were all at with Johnny Reynolds, the business secretary, where he was suggesting that this exemption for national insurance contributions for Indian workers is only if it's an intra-company transfer, as it's called. So basically an Indian company seconding someone to like their subsidiary in the UK so that that person doesn't have to pay British national insurance and the Indian equivalent. Now, if that is the case, then you can imagine the government potentially winning the argument in this political controversy. But if it's then available to any Indian worker coming over, then it starts to look more like a bung for Indian workers at the expense of British employers.
It is both true to say that this is an absolutely normal part. This convention,
I had it again back when I talked about living in Brussels. I had to fill in a form so that I could carry on paying British national insurance contributions and not Belgian ones.
So it's an absolutely normal part of the UK's interactions with sort of its trade partners, Korea, Japan, European Union, US, all that sort of stuff. It's also true to say that if you're India and your business model is, for example, these big consulting outsourcing companies that they beat the world at, that this is definitely a win for them in terms of the cost effectiveness of that offer. And So I'm intrigued. I'm intrigued to see where this goes. But you can see that it is normal for a deal with a cherished trade partner to have something like this. But I think at the same time, it will benefit India more than it would do any other country because of the way in which they export services, and particular consultancy services.
And I suppose we don't have a number for how much it's going to, air quotes, cost the Treasury
well,
in lost revenue.
The thing I would invite the very cerebral listeners to our podcast to think about really carefully with this sort of stuff is we're talking about 2040, and like people will laugh at me for this, but like it is just as relevant for a graduate from the UK to think that their career might be in India. It might be, they might even want to get, India has amazing like institutes of technology. That is the sort of flow. When you have close economic relations, you change the geography, you change the fate of nations, you change the fate of young people. It may well be, we should think the unthinkable about this, that a smart British graduate would want to go and get educated in India or get a job there as well.
And also one of the big wins the UK government is trumpeting is access to the public procurement market in India. So when a local authority or a state government in India wants to buy a service, and under Indian law they're meant to buy that service from an Indian company, the UK will now have access to some of that market.
I have to say, I was astonished by that. I mean, and on one level,
and public procurement, it's not very sexy or exciting.
No,
it's not as fun as whiskey or cars.
Not very, definitely not. But,
speak for yourself.
But the idea that I just can't get across to. I mean, I've spent a lot of time in India. My parents were born in the Bay of, not in the Bay of Bengal, but in that region, and the amount of bureaucracy, the amount of people just passing documents around, all that sort of stuff. My dad worked in a bank and he automated things, and he used to get angry every time he went to an Indian bank and tell them all their jobs were going because of computers, and yet, I think that there's some massive opportunities for Britain. But you've got to imagine India has overtaken the UK as the 5th biggest economy. It's going to be the 4th biggest economy. There's but these are one of the eventual consequences of the decision made in 2016 that these sorts of deals are available. Yeah. But it changes our economy, our geography. It changes the fate of where people might get jobs, might choose to be educated. It's big.
Oh, actually, Faisal, before you go, as our Carney commentator, the new Canadian Prime Minister was in the Oval Office just before you stepped into my office. What did you make of their encounter?
It was quite something, really, when you understand the sort of roots of what brought us to this moment, and the sort of odd respect Trump showed for Carney, and then that moment where he was trying to get. He does a very Canadian thing, and he says, "If I may." In fact, he did it to me when he was interrupting a particularly long question. He was like, "If I may." And he did it to Trump in order to say, never. He said he delivered his Canada will never be part of the US in a very sort of, in a very delicate and diplomatic way, which was just like the White House, Canada will never be part of the USA. That was his basic message. What he didn't do was refuse to engage with Donald Trump whilst he still went on about the concept of the 51st state. How that goes down back home, or whether they respect the fact that he spoke truth to the power that was in the room, is the question. So, tricky, really tricky to see this diplomacy pan out. I guess when you compare it to Zelensky, it was
convivial.
It was quite charming, and he wouldn't want to have had a sort of Starmer style loving, because that would have felt weird as well. So it's kind of Goldilocks moment for him, neither too hot nor too cold. I'm dying to find out what's going on behind closed doors.
Well, if anyone will be monitoring the Canadian-US relationship and the Canadian press reaction, it will be you. Thank you very much. Now, earlier this year, Newscast celebrated its 5th birthday as a daily podcast, and we started putting out daily episodes just as the COVID pandemic was getting underway. And one of the people who we featured a lot and heard from a lot, and who was in loads of those Downing Street tea time news conferences, was Jenny Harries, the Deputy Chief Medical Officer for England. She then went on to be the first chief executive of the UK Health Security Agency, the body that was set up to make sure we had better surveillance of what was going on in the world of microbes and viruses and diseases. And she then became Dame Jenny Harries as well. Now, she is going to step down from that job at the end of this month, and we thought that was a good opportunity to catch up with her, to talk about lots of the things that have happened in the intervening years, what she's actually been doing at the UK Health Security Agency, and also the fact that she's going to be back in the public eye for the upcoming modules of the COVID inquiry. And Professor Dame Jenny Harries popped into the Newscast studio a little bit earlier.
Hi, Adam.
Do I say Professor or Dame?
Just Jenny, probably.
Just Jenny, okay. Because I think officially the Professor comes before the Dame, doesn't it?
It does. So the Sir or the Dame comes next to the name, and the whatever the other title is comes before.
Okay. So how long have you got left in this job then? When do you actually finish?
So end of the month,
Right.
but I will be back in my usual space in the public inquiry for Module 7 at the end of May. So I'm toning down my work now.
Okay. And what is it like when you go to the COVID inquiry? It looks quite kind of high pressure.
It is. It's obviously it's a public appearance, although I've done some of those before. But I think
Famously,
the
those COVID press conferences.
Exactly. But the important thing is that you are there for a really important purpose, and there are people, many of the public, families, who want to understand why decisions were made, the basis of those, and right through a really complicated period. And so trying to get the balance of that right, I think, is quite challenging.
We'll talk about COVID a bit later on, but let's talk about the job you've been doing for the last few years at the UK Health Security Agency, actually setting it up as a new organisation. I mean, it's not a household name yet, is it? How do you explain to people who've never heard of it what its job actually is and what you're doing there?
So we have a mission statement, but the most important thing is we're there to protect the public. But we do that through contributing to scientific growth and through operational response. So the sorts of things I usually say, if you have a case of meningitis in your schools, the local health protection teams in local authorities and our own regional teams will be out supporting those families. You may get a call from them. That's how you might find us on an individual basis. Of course, but we cover every environmental threat. So it might be radiation, it might be a chemical threat. We're involved, for example, in the North Sea tanker collision. We even get involved in space debris fallout over the overseas territories. So whole breadth of things. So operational response is one, but the opportunity really is in the scientific growth. We have some really unique scientists and scientific technical skills, more than 30 different technical specialties across the organisation. And they range from things like data modelling and data surveillance to working with industry on preclinical trials for new vaccines, and right through to sort of things like the normal vaccination programmes or the radon measurements in your homes.
Basically, lots of things that in the old regime before COVID were sort of scattered around different places, and some of which we were quite good at as a country and some of which we weren't so good at. It was just bringing all that together in one place, really.
Bringing it together, but the new things I think about COVID were working with industry is one. So we've absorbed parts of what people may remember as the vaccine task force. Not all of it, but a large part of that to ensure that we can develop and support the development and use of vaccines earlier. And then our data skills as well. So I think we are raising the profile of some of the older skills that we've had in this country for many years, and combining them with brilliant surveillance as well.
So that's loads of things, but just pick one example where you feel, okay, by setting up this organisation and by running it in this way, I've made the country healthier or safer. Just pick one thing.
So I'm going to say priority pathogens because I think people will understand that in the context of the pandemic.
Not sure I do. But
So priority pathogens, if you look across at the World Health Organization is doing, or we're worried about the next pandemic, we need to keep an eye on what we think might be the next pandemic. So we published last month a priority pathogens framework tool. And what that says is these are the sorts of viruses, bacteria, pathogens that we think might be causing the problem going forward. These are the ones we all need to watch. These are the ones we need to build defences against. And then we use that tool to work with research institutes, with pharmaceutical companies, with those developing products. So it's not quite the same thing necessarily. And that makes us better prepared for the future. And I think the real step change I think we can make post-pandemic is to be prepared ahead of a potential pandemic so you can actually stop it in its tracks.
I mean, I don't want to reduce like a complicated, nuanced tool that's a kind of framework for lots of people to think about various things to like a what's the top 5 most dangerous things coming our way. But you know what I'm going to do now. I mean, what are the top few things that tool tells us to be worried about?
So the things that you will see there,
And I know it's more complicated than
it's
that.
much more complicated than that. And actually, you would expect that we have not said these are the top 5 things intentionally. But the most obvious one at the moment, of course, is avian flu, so human pathogenic avian influenza, and the work on H5N1. So you will see that is there, and you can trace what we're doing through our work, whether it be buying in vaccines preemptively for those most at risk, working on...
Are we doing that on H5N1? Right, okay.
But of course, we know that the H5N1 that we have now, because we're not in the middle of a pandemic, is not going to be exactly the same H5N1 or other pathogen, avian pathogen, that is going to cause the next pandemic. So we are continuously, for example, testing our diagnostics to make sure that they will pick up any new avian flu that we're detecting.
And what is it about avian flu H5N1, which sort of pops up in the headlines from time to time and then disappears? What is it about how that's circulating in the world at the moment that means that is on your mind?
So there'll be millions of different pathogens across the globe at any one time. We clearly can't track all of them, but what we're starting to see with that one, and we will see with others and have historically, is that they will start to move from zoonotic species, from animals to humans. But prior to that, they will move between animal species, and we're starting to see that. So the cows in the US or a sheep, these make the headlines, but actually it's travelled through a number of different species. So mammals through seabirds, and we have now seen a few human cases. What we're not seeing is transmission between humans, and that's really important. And so there are lots of proactive surveillance steps that we take, that if we find a human case, we circle in and test everybody around them. We provide antivirals. But also we're out looking. So every time there is a case on a poultry farm, for example, where there's culling going on, we are proactively trying to survey for cases.
I mean, going on the UK HSA website is amazing because like every page has got another interesting disease / scary / potentially really worrying. And I don't want to do like a sort of like world atlas of diseases, but I mean, Mpox, where have we got with Mpox? I noticed that's starting to pop up on your website again.
It is. So Mpox was actually a really good example of how the new organisation has worked brilliantly. So it was UKHSA who took early notification, because of good links with infectious disease specialists, of the 4 first cases of what's called clade 2B, of Mpox clade 2.
What does clade 2B mean?
So slightly different varieties, let's put it that way. So clade 2 was the first one back in 2022, which was starting to, we'd had cases before, it was starting to transmit differently. We raised the alert on that globally. Other countries started to look, and you could see that the transmission routes of that Mpox virus were starting to move around the globe. So it was a controlled but global transmission. The one that's popped up more recently is clade 1B. Now, when that was first detected and detected spreading effectively back in Africa, it was reported to have a much higher severity rate, so people being far more adversely affected and very sick with it. In actual fact, in recent months, what we've been able to do is track both of these. We have put in a vaccine programme for those most at risk. We've treated both clades first as a high consequence infectious disease, so really tightly, until we had good evidence, and then stepped that control level down. And now we are managing it as a disease which we actively treat and monitor. We support individuals. We need to stop it spreading still. It's really important. But we do have vaccines that are effective.
And what's kind of like the public-facing health advice about Mpox at the moment?
So for Mpox, it's a low-risk threat for most people. If you've travelled to endemic areas in Africa, or you are it's mostly transmitted through sexual routes. It's a close contact transmission. And as I say, for those who are at highest risk, so men who have sex with men and other groups, they can actually access vaccine for Mpox now. And that programme is being rolled out even more as we head into the autumn.
And is it the case that if a disease or a virus or something emerges and you are one of these high risk groups, the state has a way of you will know that you're in that group. Is that how it works? In that if you are, I don't know, like a mum living in West London, you're very low risk of mpox. But if you're a gay man living in East London, you're a much higher risk. The state will just somehow be able to get to the man, but not the woman.
So I think this is really important. You have to identify how the disease is transmitting to start with, because then you know who it is you're trying to track. But most importantly for mpox, this is a hugely sensitive area. People are not going to go out and talk about this public, and it's often important. And this was a good example where, as UK Health Security Agency, with a great big shiny government badge on and a label that says security, we're probably not the people that those individuals would initially comfortably turn to. So what we do is work, for example, in this case, with local sexual health services, with things like Pink News or different groups, Terence Higgins Trust, where those people most likely to be impacted will be able to receive information from trusted sources. And then we do put out standard information, because if we're talking about the woman in East London or whoever it might be, it's low risk for most people. But actually, if a partner of hers has just travelled to Africa, there's always a small risk there. So then we put out standard information to those individuals. But we do try and do that in both a sensitive way through sensitive channels. You won't always see our badge up there, but we'll be working with groups who are trusted.
Reading your report that came out earlier this year about kind of all the trends of diseases. I mean, there's so much interesting stuff in there, but the thing that really jumped out at me was something that sounds really old-fashioned and retro, but not if you've got it: TB, tuberculosis. Yes. And it went up by 11% one year and then 13% the next. Yep. What's driving that?
These are still relatively small cases, and most of the case numbers that are coming have been developed overseas. So they're coming with people sometimes with latent, so they may have had TB or didn't know, right, and they have latent TB. And actually, one of the things for this country, and we've just put out a call for evidence exactly for that reason, which is TB is entirely treatable and curable. It's not something, but we need to detect it. It's not something that we should have growing, transmitting frequently in this country. We have good antibiotics to treat it, and it's important that we do. There's increasing multi-drug resistant TB, so getting on top of the problem, treating it effectively and fully is really important.
And I was quite struck by the statistic there that certain migrants are meant to be tested for TB when they arrive in the country, but they're not. That seems like quite a big flaw in our health security.
So I think for people who are arriving, there are many reasons why this is very difficult. People perhaps don't know what vaccinations they've had when they arrive. There may be language difficulties. You know, even with the very best of interventions, when people arrive, it might be a short while afterwards that something arises or somebody has symptoms, for example. I think one of the biggest problems with TB is the way the systems have been set up is that where, for example, you have a community coming from a high-risk transmission area, so that's a rate of 150, over 100,000 people. So you can imagine from a high-risk area to a location in the UK, historically, the services have been set up in that area, so they'll be pretty good. And generally, we want to, quite rightly, treat people as individuals in the community, and so they will be approached predominantly through primary care services.
So in other words, you don't want to have a blanket rule where it says everybody coming from country A gets automatically screened for TB.
Well, it won't always work that way anyway, because some things will develop or you won't be able to pick it up at the border. I think the issue here is that because we have individuals joining communities right across the UK, the way that system has been set up means it needs a bit of a rethink to make sure that those services, everybody basically, is aware that TB could arise, particularly if somebody has travelled or been born in a high transmission area.
What is that rethink, though? I'm struggling to think what you'd actually do as a policy.
Well, I think, as I said, the services predominantly have been focused in areas where we thought people would arrive. If actually people coming from abroad are travelling to different parts of the UK, we just need to make sure that every part of the health service is aware that there may be an individual with latent TB who needs finding and treating in their area. And the other one, obviously, is, of course, there are some places, so prisons, for example, we've had outbreaks previously in prisons that we keep on top of the health protection work there and stop transmission.
Because I can imagine you as a public health person want to avoid a headline saying more migrants should be tested for TB, because that could come across as like xenophobic or kind of like you're pinning the blame on somebody.
Absolutely, and I don't think that is it. We can't help if we're born somewhere and there is a background risk of infection, that is problematic. But I think even more importantly, we need to realise that many routine health services are disrupted currently in areas of the world where there is turmoil and war, and so the normal sorts of health services and vaccinations may not be available to these individuals who otherwise would have taken them. So we need to not blame, I think.
Are we heading for a little bit of a problem with people being suspicious of vaccines? And I'm thinking like measles in America, and there's a few other references in your annual report to diseases in this country where if people were getting more vaccinations, there'd be fewer of the diseases, things like whooping cough.
So we should be worried. And actually, we looked to the States. I looked last night, checked what the last data there was. I think they'd got 935 cases on the 2nd. I can almost guarantee that'll be over 1,000 now. Area, I think North Dakota just had its first case since 2011. The US was measles free in 2000. So these are childhood illnesses which perhaps people don't realise quite how serious they are. I've often said to colleagues, I remember my father was a virologist, so I used to be jabbed with everything the minute it became available. And I didn't have measles vaccine. It wasn't available routinely. And I had measles. So did most of my classmates. There was a routine where you were off school. We know that for every time there's a child who's got an infection, on average, one parent will be off work for a week. So it's not just the kind of human and child misery that goes with it. There's a lot of economic and health service implications. So I think 13% of the US kids are currently ending up in hospital. So we should be worried for all of those reasons. The saddest thing about it is, of course, it is entirely preventable. And if you look at the data coming from the US, 96% of those confirmed cases, and there are likely to be many more not formally confirmed, are in unvaccinated individuals, and we just need to keep those facts in mind.
And what's the number one cause, you think, of people not getting vaccinated? Is it misinformation from anti-vax influencers on social media?
I don't think so. I think it's a variety of causes, which is never good for a headline newscast. But actually, there is an underlying trust issue that is not just in the information. I was out in Birmingham when the cases rose there, talking to the communities. What a lot of people say is they are their own individual communities, and there has been a loss, I think, of this individual connection over maybe a family generation with a long-term trusted health service relationship. So health visitors, when my children were young, for example, and they looked after the family. If the family trusted the health visitor for the first child, you could guarantee the rest of them would be vaccinated. Now, it's clearly not as simple as putting in some health visitors and saying, please trust us.
But the NHS has become too impersonal.
Well, I think, the current direction of travel for the health service is to go from central much more back to local. And I think that is likely to help this situation. On the misinformation side of things, undoubtedly, we have different media. We did actually a session on this at the UK Health Security Agency conference back in March, and we had people like Dr. Vishal Virani from YouTube and colleagues from Financial Times and from The Lancet. And it's actually on YouTube, so if you go and have a look, because it's really interesting what they were saying. Points about fractured information. So there's a job for us, I think, all to get our information together. Vishal actually saw it as an opportunity, which I think is quite interesting, that never before the COVID pandemic had so many people wanted to engage with so much information at such an important point in time. So there is an opportunity here, but it's about getting constructive, trusted information.
People didn't necessarily want to engage with the information that was true.
Well, so I think
they disagreed with.
So I think there is a role for all of us, whether it be, BBC, health professionals, and this came through that the Financial Times, The Lancet, YouTube were all taking slightly different approaches, but actually it was to prevent some of the fracture in the information. So many parents, it's a practical thing, can I get my kid to the clinic?
Yeah.
Is it accessible? And the NHS is trying to move that in a more positive direction, I think.
Let's talk about COVID then. I mean, does it seem like sometimes like a weird dream, like the idea of you stood there with Boris Johnson giving people basically dating advice?
But it wasn't
Which is the famous one, when you told people to move in together if they wanted to see their boyfriend and girlfriend.
Yeah, well, neither of those 2 points were on the job description. No. I like that. It does. I mean, it felt, I was saying to you earlier, I think sometimes people think of myself as being very serious, but actually it was a hugely serious time. And I knew if you're speaking to 27 million people each evening, you need to try and be clear and get good information out that will help them right through the pandemic. And often, obviously, there's a slight pull there between, as we've seen in other places, trying to get clear basic science out, which will prevent people becoming infected, and then obviously the political and practical handling of the pandemic. But
do you think sometimes the information or the advice was maybe too clear, and actually people maybe overreacted, or we lost the nuance?
It was a learning curve, I think, for the whole population, for politicians, for professionals as well. I mean, it was also a huge privilege in many ways, because you trained to do public health interventions, and this is the biggest public health issue for the last century. So I think there was clarity in some information, but I think people used it differently. I always used to try and come back to basics so that people could use the basic principles through the pandemic. So whether you had a cycle of infection or a new variant, actually the principles of things like being outside is safer than being inside, opening your windows.
Yeah, but the advice was stay at home, protect the NHS. The advice, that's the advice that people heard.
So I think they heard different messages at different times, and in some ways that also was intentional, that it was signalled that ministers wanted to signal a step change at different points. It was important, though, to stay at home and protect the NHS, because in this country the NHS, although it got very close, was not overwhelmed, and people who needed treatment for other interventions, for other causes, actually got it in the main.
Do you think you scared people too much, though, in retrospect?
So I think there is a narrative that's emerged from the pandemic about scariness. It depends who presented it, how the message was amplified. I try, as I say, to give basic principles, but I think the public has the right to have the detail and to make what they want of it. It should be transparent, the information. And we saw that as we got through the pandemic and people got used to, in fact, the things we were talking about, R0 and transmissions and variants, would never have been in the public domain before the pandemic arose. At the end of it, you could see that as the waves of COVID, which are still happening to a degree, were rising and falling, the people were looking at the Health Security Agency dashboard and were making their own judgments about how much they moved. And you could see that in Google mapping of where people were moving, or in shopping areas.
But there's an argument that people were doing that at the start as well. And it wasn't just at the end, once everyone had been schooled in this, that there's an argument that people instinctively, in the weeks when it was really great, could tell, and that people stopped going out before you closed the bars and restaurants.
I think that's right. Not everybody did. And obviously people will interpret it in different ways. And I think, at the end of the day, it's ministers and the politicians who make those decisions. It's for us to flag the epidemiology, the risks that go with it. I don't think there was anything incorrect about how the data was presented, but you did get multiple different versions of that as different people looked at the data and took their own view. do you regret being pictured and filmed with next to politicians so many times? Because it seemed like you were both, well, I mean, of course you were all on the same team-ish, but you did have quite different jobs, as you were just saying. Their job was to decide, your job was to advise. But when we saw you stood at those lecterns in Downing Street, it all looked like you were doing the same thing. And I've had that feedback. I mean, we famously in my own family, we've had a bit of a tiff early on. Absolutely, because it wasn't so. If I have a medic daughter who understands the distinction completely, if you're not in that space, you won't. I think you're right, but I think it's also really important that professionals and scientists are there for the public. And the role, to some extent, is if you go in as an advisor, if your role is Deputy Chief Medical Officer and you're advisor to the government, it's not unreasonable for the government to expect you to be standing next to them explaining. what you will see in some of those details, and I remember some of them vividly, in the areas where I felt it was appropriate for me to put forward the science or the principles sitting behind prevention or transmission control, and then passing it back to whichever minister was on the podium for the political perspective.
Not to dive too much into the private conversations around the Harries family. I'm assuming it was on Zoom at that point. But so, what your daughter, who's a doctor, she wasn't happy with you.
No. The daughter of the doctor understands the distinction completely.
But it was her siblings that were going to be like,
those who don't
why?
work in the civil service absolutely could see that her colleagues, her friends, were also seeing exactly what you said. They would see a scientist, a professional, a doctor standing next to the politicians and assuming their jobs were the same. And of course, as you said, that's very different.
All right. So one of your kids basically had a bit of a go at you for being too close to Boris
We won't
Johnson.
say which, or we might repeat the.
But that is basically kind of what. But when you brought it up, so it's like, so actually you got a bit of grief from your own family from maybe being too close to the politicians.
It's been really interesting actually to see the different reactions. In fact, I used it. It was important to understand different people's perspectives, and you'll get very honest answers and views from your own family. So if you have somebody working on the front line in the hospital, that's a pretty good view of what's happening there. If you have somebody working in another part of government, if you have somebody completely outside either of those spheres, it's actually quite a good sense check of where the public are. And then it helped me to try and tone and frame what I was saying.
Oh, so actually there were times when like the advice from your own kids meant that you sort of put like a bit of a wall between you and like Matt Hancock or you and Boris Johnson.
No. I wouldn't put it. It's more to do with the messaging. So if you can pick up from the front line of the health service and many other routes, not just my daughter, I might add, that doctors are worried about X or this is a problem, then A, you can go and see if there's action that you need to take on that, and B, you can make sure that if you have the opportunity to speak to people, whether it be on the podium or through professional means, then you can answer those concerns or queries.
There are loads of things I could ask you that have been controversial about the government handling of COVID, whether it's the advice on masks, whether it's that email you wrote about care homes, which you've been asked about a few times, and people can see your responses to those things. But I just wanted to focus on one thing that people get very emotional about, understandably. The advice about funerals and like limiting the number of people who could go to a funeral. Take me into maybe you weren't in the room where it happened, but take me into the room where it's decided that that's a good and an okay and a moral thing to do.
So given that we haven't got to that in the public inquiry, I might contain some of my comments, but I just maybe flag a few points. And, it wasn't my decision at the end of the day, but on any topic we might be asked about the practical transmission risk. The issue with funerals, and you can see, funerals did become an exception, and end of life was an exception. And
became eventually though.
Well, end of life care also was always an exception for various visiting elements. But the key point here is for funerals, the majority of deaths in this country, in or out of COVID, will be in elderly people. It was clear that elderly people were those most affected. We know that the risk of transmission actually is often greatest in small family groups, and if people are obviously at a very emotional time, the most obvious thing that you do at a funeral will be to go up to somebody, hug them and comfort them. That immediately raised the risk. Whether it be COVID or if we look to control, for example, of funeral rites for the Ebola outbreak back in 2014, it's where those rituals are occurring and where people are comforting each other, and perhaps where emotions mean you drop your guard, that they actually become very, very high risk settings. And it's that background sort of practical content about the risk of transmission and the duty to protect people who might attend an event.
But then why wasn't the advice don't hug people at funerals rather than just like you can't have many people at the funeral? Because the advice was like, this is the maximum number of people you can have at a funeral. You've got to sit really far apart. It's going to be like a really rubbish funeral.
I actually have not looked at the funeral advice for some time. And clearly, at the end of the day, that is a ministerial decision. And I know, my own father passed away at the start of the pandemic. So I know how significant it was and what an emotional time it was. But those were the sorts of principles about health protection. Clearly, the individual who has very sadly passed away has gone, but actually the risk to those there, what you're trying to do is prevent any more cases happening.
Did you get to see your dad, or was that one of those horrible situations where you just...
Yeah, so it was right at the start of the pandemic. So in many ways, rather sadly, I'm very grateful that some of these rules were not in place at the time, and I was able to say goodbye. But of course, it meant that for the months afterwards, it took me some time to get back to sort of follow through, sort it out, and go through a normal bereavement process.
So many people listening to this will be like, they were deprived of that opportunity because of the rules, and that's really sad.
And I accept, it's very difficult, but I think ministers made choices and made decisions. There was, I think, CMO Chris Whitty has often said there were never any good choices. They were the best choices on the evidence that was there at the time. And I think many of those, importantly, we look back and go back to vaccines, of course, that the vaccine, the protection that you got with vaccines, then meant that those risks were entirely diminished. But very early on in the pandemic, everybody was unprotected, and particularly the elderly generation, who mostly would have attended funerals, would have been significantly affected.
And also, we forget there's a horrible parallel universe where the vaccines didn't work. And I think we forget that there was a branching point in history where there's a world where we're all still at home.
And if you look at HIV, for example, we still have no vaccine. We have many good treatments. And so that might have been a different option. But in this case, it is the vaccine that has brought us all back to some degree of normal societal life.
Right. So this big job is coming to an end. I mean, what would you like to do next?
Well, ideas on a postcard is what I usually say. I think I've stepping down with my head, not my heart. I've got plenty more things I would like to do with the organisation, particularly on developing the science growth agenda. So I think I've had the fortune, I would say, of working with many areas of industry in, whether it be pharmaceutical or diagnostics. We in UKHSA have put in many new forms of that. So we've started a vaccine development and evaluation centre. We've started a diagnostics accelerator. We're better prepared. But there are still huge opportunities on which are win-win-win. So, it's good for people's health. It's good for the science agenda. It's good for economic growth. If we can get better join-up between... we still have... I've seen it from the industry side now, where if I look from industry into bits of the civil service, we are quite disconnected still. Lots of work going on in that area, but lots of opportunities. Yeah,
because you talked about the vaccine task force. That was a completely unprecedented, completely innovative way of doing things. You've had a real you've lived on the front line now, and that kind of high adrenaline, really close to power, dealing with a crisis. Is that stuff that you still want to be involved in, or have you had enough adrenaline for a lifetime?
A bit of chilling would be quite nice. I don't mind those sort of things. I usually keep pretty calm. I get on and very pragmatic. But it would be nice to sort of go and walk up a few hills and not be on call at the weekend, which is otherwise sort of 365 days a year, and actually genuinely get a bit of fresh air. And part of the thinking was to role model healthy ageing. Now, I messed that up completely by doing my knee in about 5 weeks ago.
Oh, no, what happened?
A trip to go and see all the troops around the country before I left in our teams in various places, and a bit of collapse there, on the mend.
Okay, glad to hear it. So healthy ageing, that's like getting people to be on board with the fact that, it's the whole, what was it the other day there? 70's the new 50?
Well,
I saw some research saying that.
I'm in my heading for late 60s, and I did see that the oldest lady in the world, I think now, is a British lady of 115, and I thought, have I actually stepped down a bit early here?
Another 50 years.
And then I was listening to Tony Fauci, of course, who's a legend in health protection in the US, and I think he's potentially still doing 10K runs at 84. So that's basically where I think I should be going. But I want to do some just exercising. I'm very aware that you can, to enjoy older life, I think you have to work at it, and that's what I'm going to do.
And just before we were recording this interview, we were having a bit of a reminisce in the Newscast studio about all the things that we did in the early days of COVID that now seem like from another world. Did you do all the classic things? Did you bake banana bread?
I didn't have time to vape banana
Did you watch
bread.
Tiger King on Netflix?
No.
Remember when Tiger King was big? Did you ever do a Zoom quiz? With
I
your
think
colleagues and family?
I tried one with my family and then probably got called off. I did not have any spare moments at all for weeks and weeks and weeks, literally. So as sort of people emerged, their experience of the pandemic was very different.
Very different.
I had one. I met one family in actually it's 2 years down the line, trying to work through then my late parents' house. And had merrily put a settee for the up on a eBay or local Gumtree or whatever it was. Other fora are available. And the lady turned up and she said, "I think I know you don't." I usually sort of say no for the first time.
Yeah.
But then I spilt the beans and she said, "Oh yes," she said, "it was great. You used to come on the TV 6 o'clock. I got all my boys back from university." She said, "Gin and tonic time with Jenny."
Gin and tonics with Jenny. Not perhaps what you intended. But...
Absolutely not. But it clearly, it's a very, very different experience.
Right, just before you go, because we've got to wrap up, but I want to get like a sort of a health tip from you. And because I always remember the late Michael Mosley, interviewing him around about it 1 January, and we were doing like New Year's resolutions, sort of health tips. And he said, get your blood pressure and your cholesterol checked every January. That's better than any number of like resolutions you don't keep, because he was just like, they are really good signals of if something is going wrong with your health. And so I now do every year, and that was probably about 4 years ago. So now every January I go and do those two things, and sometimes it's easy and sometimes it's a bit more difficult. But like, in Michael Mosley, what was it? One good thing, wasn't it? Like, what's one good thing you would recommend?
I would support him, but actually, if you find it's rubbish, you've still got to do something about it. So I'd go for the prevention first. So my rule is I have to be able to run, however slowly, a 5K park run on my birthday every year. Right. And I started at 60. And I intend to keep going. And my son sent me a video of somebody competing, I think set a new Masters record at 90.
Right.
And I'm thinking that's where I need to go.
Oh, so a sort of thing just that is a sort of like a test, like a baseline thing. Absolutely. So you can just get a sense of like that you're still firing on all
the logic is if you can do that and you come out okay, you probably don't need your cholesterol and your blood pressure test, although I would still encourage people to have them. But I'd probably check mine.
How long does it take you to do a park run? What's your time? Not that we should focus on elite performance, but...
probably about 30 minutes-ish. I'm not very... I haven't been...
Well, you've got your knee,
I have, but should be about 20, I think.
Also, what's the best medical drama on TV? What's the one or film that's the most realistic? That's that most chimes with your experience working for all these decades?
I think they're probably... So you can see I don't watch TV, so Casualty used to be the one I would watch. But I think they usually got pretty good input now from clinicians to make sure that they are looking pretty realistic.
Jenny, thank you very much.
Thank you.